Good morning. Before I begin my regular update, I want to encourage Pennsylvanians to drop off their election ballot at their county election office today. Don't wait until the last minute. Please make sure that your ballot is received before 8 p.m. tomorrow to ensure that your ballot is counted. If you are voting in person, it is safe to vote. Make sure that you add your COVID kit to your voting plan. Your kit should include a mask, a pen, hand sanitizer, and the COVID Alert PA app on your phone. Now to our update and some of the data points that we are continuing to track. Today, we are reporting 2,060 new cases of COVID-19. We are also reporting that on Sunday, there were 1,909 new cases of COVID-19. This brings the total number of COVID-19 cases in Pennsylvania since the beginning of the pandemic to 211,996 cases. We have now seen 28 days where we have reported more than 1,000 new cases of the virus per day. Over the last week, we have reported 5 days with more than 2,000 new cases per day of COVID-19. Of those cases, 76% are now considered recovered, meaning that it has been more than 30 days past the patient's positive tests or onset of symptoms. Now, that number is decreasing with the high number of new cases. Please remember, we continue to see many people who are considered COVID-19 long haulers, where a true recovery may take months as they continue to deal with chronic symptoms from the virus. Today, we are reporting 1,267 individuals are hospitalized due to COVID-19 in Pennsylvania. This number has been steadily climbing over the last number of weeks. Last Monday, I reported 1,104 individuals hospitalized due to COVID-19. We expect the number of hospitalizations to continue to increase, and hospitalizations normally rise a few weeks after the increase in cases. Our healthcare systems are better prepared to address the virus than they were in the spring, but we all must do our part to prevent further increases in hospitalizations, particularly as the flu season is here. Another trend we have been observing is an increase in our percent positivity, both statewide and in counties. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now at 6% statewide. Last week's percent positivity was 5%. In addition, 40 counties in Pennsylvania, 40 counties have percent positivities above 5%. That's 10 more counties than was reported last week. Another data point that we are closely monitoring is the number of people who have reported going to a business or a large gathering 14 days prior to the onset of symptoms. For the week of October 18th through the 24th, only 24% of people that were asked actually answered the question about whether or not they frequented a business or attended a mass gathering 14 days prior to their onset of their symptoms. Of those that responded and answered the question, 489 said that they had been to a business establishment, and more than half said that they had been to a restaurant in the 14 days before they got sick. 514 had said that they had been at a mass gathering in the 14 days before they got sick. I cannot stress enough how critical this information is for us and how important it is for people to participate fully in the case investigation and contact tracing process. As you know, we now also have the COVID Alert PA app, which is assisting us in alerting Pennsylvanians if they have been exposed to another user who has tested positive for COVID-19. I encourage you today to join the more than 400,000 Pennsylvanians who have added their phones to the fight against COVID-19. And please download the COVID Alert PA app from the Apple or Google stores. It works on Apple and Android platforms, and it's completely free. And remember, we are not tracking your whereabouts. It uses Bluetooth technology, same technology that hooks your phone to your car or your headphones. Each of us, each one of us, has a collective responsibility to protect our communities and our most vulnerable Pennsylvanians from COVID-19. We can control the spread of COVID-19. This virus is not going away. It will still be here as we move further into November. And that is why we all need to answer the call. Everyone in Pennsylvania needs to answer the call to assist in reducing the spread of COVID-19 in our Commonwealth. It starts with answering the call if you test positive when a case investigator reaches out to you. Please answer the call and participate in the interview. A case investigation is completely confidential. It is completely anonymous. But you might save a life by being honest about who you were in contact with and the places that you had visited. Answer the call if a contact tracer reaches out to you. They may tell you that you need to stay home for 14 days, even if you don't get sick, but you might save a life just by following those directions. Answer the call to wear a mask, to social distance, wash your hands, and download the COVID-19 PA app. We must all stand united in our fight against COVID-19. And as always, please stay calm, stay alert, and stay safe. Thank you. And now I'm pleased to answer questions. Yes?
Seth Kaplan for ABC 27. Advice for voters tomorrow to protect themselves against COVID-19. This from our affiliate over in Pittsburgh asking.
Sure. Well, as I mentioned, we are asking people to have a quote-unquote COVID kit. And so what that means is please wear a mask to the polling place to vote. Please bring hand sanitizer so you can hand sanitize your hands. Please bring your own blue or black pen so you don't have to borrow other people's pens, etc. And I think it's really, really helpful if you download the app. And so that's the way people should prepare if they're going to vote tomorrow. Please don't wait till, the polls close, I believe, at 8 o'clock. Don't wait till 7:45 to go. There might be lines, etc. So go early and vote.
Okay. I have a couple others of my own, but I'll let everybody else go first and come back around to you.
Do you have a question?
Go ahead.
Please.
Oh, okay, sure. County by county positivity and other stats. We've noticed in the mid-state, Franklin had some really unfortunate numbers. Lebanon continues high. Your reaction broadly to any of that, and also if you think we collectively as the media and public are focusing too much on certain numbers and maybe not enough on others in terms of just having context. We know there are more tests and all that. What are we getting right?
Sure. Well, there are 39 counties right now on our watch list in terms of those parameters. And 56 out of 67 counties in Pennsylvania have had an increasing number of new cases over the last week. So really, COVID-19 is increasing in all regions of Pennsylvania. And this is following the same pattern that we're seeing in the rest of the country. Virtually every state in the country is seeing significant increases in terms of the number of new cases of COVID-19, as well as percent positivity, particularly the Midwest and Mountain West, but really it's in all parts of the country now. And so Pennsylvania is not an island, and so we are seeing the same type of increases. In terms of the numbers to follow, what I am looking at every day is the incidence rates, the increasing incidence rates, the number of new cases, particularly per capita, per 100,000 that we're seeing in Pennsylvania and in those counties. And then we closely track the percent positivity, both in Pennsylvania and in the county. So we're looking at those really carefully. In addition, we're looking at the impacts that those increase in new cases are having. And so that is the hospitalizations that that we're seeing, the increased use of intensive care units and ventilators that we're seeing, and then, of course, the ultimate downstream impact is the number of deaths we're seeing. So we are seeing increases in terms of the number of hospitalizations. That usually lags about at least 2 weeks or so from the increase in cases, and we are seeing an increase in what is called the epi curve in terms of the number of new deaths. Now, none of those are where they were in the spring. And so we are seeing rates higher than we saw in the spring, but our hospitalization rate of 1,267, that's compared to over 3,000 in the spring. Ventilator use is decreased. Some of that is the decreased standard of care. ICU use is decreased. But our death rate has increased some, but not to where it was in the spring, where we often saw more than 100 new deaths per day. I think that that's due to a number of different things. Our medical care is much better. Our intensive care is better. We have therapeutics such as remdesivir and dexamethasone and other possible therapeutics. Also, the age range is actually more broad. We're seeing more really increases in all age ranges, school age, college age, middle age, and seniors. But we're doing a much better job protecting our long-term care living facilities, particularly with the RIC program, the Regional Collaborative Program, where the Department of Health and Human Services and PEMA are working really, really closely with academic medical centers that are engaged with all of those long-term care facilities. We are in much better shape than we were in the spring. However, as the increases continue in the fall, as the weather now is colder and people are more indoors, we could see challenges to our healthcare system. And so that is why we all need to work together. There are 3 ways to deal with a pandemic, right? You can work on containment. We are now getting 36,000 test results per day. We could never have imagined that in the spring. But when those test results are positive, we need people to answer the call, answer their phone, answer our questions for contact tracing and case investigations. We need people then to isolate and quarantine. That's how you contain outbreaks. We have our current mitigation in place in terms of restaurant capacity decreased to 50%, in terms of limitations on indoor and outdoor large gatherings, so those continue. But we need people to do the simple things that I talk about every single day, which is why I never get tired of repeating it. We will be in much better shape if everybody wears a mask and washes their hands and avoids gatherings and social distancing. And then, when they're deemed safe and effective, we're going to be working on the distribution and administration of the vaccines. The vaccines are not going to be a miracle cure, but they're going to be very, very helpful. And on, I believe, Thursday, I'm going to be talking about vaccines on a press call in terms of the work that we're doing in terms of preparing for when the vaccines are deemed safe and effective by the FDA, and we get the advisory committee from the CDC about how we're going to distribute and then work to administer the vaccine. So that is the plan. And everybody needs to do their part, which is why we ask people to stand united with us, because if we all work together, we can control COVID-19. If people don't work together, then it's going to increase.
Diane?
I'm fine, thank
Okay.
you.
Thank you. Yeah.
Secretary Levine, Todd Bartley, TalkingWaySport.com. Secretary, we've had a whistleblower come forward that's part of the contact tracing program and shared some disturbing details about how fundamentally broken the program is. Are you aware of any of the deficiencies currently going on in the contact tracing program?
So we have complete confidence in our contact tracing program. So I don't know specifically which whistleblower you're talking about, but I mean, our program, our whole containment program involves the testing that we talked about in terms of working with public health nurses in terms of the case investigations, and then we have very highly trained contact tracers that are working to let people know that they have been in contact with someone with COVID-19 and to quarantine, and we think we have an excellent program.
As a follow-up to that, within the quarantine that you're putting out, there are any number of letters that we've obtained that are going out recently with the jump over 2,000, as you mentioned, over the last 5 days per day. How many Pennsylvanians are getting quarantine letters on the eve of the election? And is it safe for somebody in quarantine to go vote tomorrow?
So there is nothing about the election in our quarantine letters. So I don't know how many people are getting them today. It depends on how many were exposed. But those phone calls and those notifications are continuing at regular intervals. And there is nothing about voting or the election in the quarantine letters. They're standard. And it is if someone is in quarantine, there are ways that we have that they can vote. You need to contact the Department of State, and they can make special provisions for that person to vote.
Okay, Seth, do you have anything else?
I'm good, thank you.
Can they go in person tomorrow and vote if they're in quarantine?
I don't have the criteria exactly how the Department of State is going to do it, but the Department of State will work out for people who are in quarantine to be able to exercise their right to vote. And so we really recommend that people contact the Department of State. The story that was on social media is completely false. Thank you.